Hi, and welcome back to another episode of Healthcare Simplified with Manvir Victor. As always, smash that subscribe button in the bottom and follow us for more. Now, today, since it is International Women's Day in March, we've got two fabulous women sitting down with me in the studio, going to teach me things about women's health that I didn't know, that I've asked the question. We've got here with me, first, closer to me on my left, is Nurul Izzah Anwar, who is the executive chairman of Polity. Now, Polity, tell me a little bit about Polity, please, and what is it that they do?
We are an evidence-based and action-oriented think tank, focused mainly on empowering women and youth across Malaysia and hopefully regionally.
Okay, fantastic. And we have with next to us, of course, we've got Dr. Yolanda Augustin, all the way from St. George's University Hospital in the UK. And you're a Malaysian. You spend a lot of time here in Malaysia helping people. Tell us about the interesting global role that you hold at St. George's.
Yeah. No, thank you so much. So I'm focused on the area of global oncology.
Okay.
So a lot of my work in terms of field work actually happens in Malaysia,
Right.
and also in underserved communities in Sabah and Sarawak. And we're focusing specifically on how we can actually make cancer drugs more affordable, more accessible,
Okay.
And also diagnostics.
Okay, thank you. Well, I mean, the reason we have both of you here, because we want to talk and unpack this a little bit, because women's health is extremely important. Women are always looked at as the glue that ties the entire family together, right? And unfortunately, women sometimes put themselves last within their family. They don't take care of their own health. They're more interested in the health of their children, maybe the husband, everyone around them. And that has left them having not enough sex. Now, this is not because of anything else, but maybe they just don't put themselves first. And we need to reach them, because if we lose the glue that holds the family together, then the family's gone bust, right? So we want to talk about that. And Izzah, what you have been doing over the years that we know each other, and you've been doing tremendous things right down at the core where the family is, And tell me a little bit about what is it that you do at that ground level, and why do you do it?
First, I'd like to thank you, Manvir, because you actually had experience firsthand.
Yeah.
As a patient, the challenges in healthcare and accessibility, and this is really a lot of patient advocacy, right? We're trying to push forward this information for everyone out there. And for me, that's what changed my outlook. When I was a member of parliament, when we were visiting homes, we realized women, especially in the PPRs, they will be the ones caring for everyone. As you mentioned, they'll focus on cooking, trying to make ends meet. If they are a single mother, it's even worse, the double burden. And then they'll be the last to go for cancer screening, even for pap smear back in the day. And you realize, even for breast examination. And what happens is they then come to hospital, public hospital, with late presentation in cancer, and within 6 months they've passed away, usually with a spouse leaving them and the children bereft of their love.
Right.
So I think that's why when we identify one of the types of screening for cervical cancer, that's identified by the WHO.
Right.
It can be eradicated within our lifetime. So I think it's also then mapping out what kind of programs with existing entities.
Okay.
Because we're not, wanting to try something from scratch, right?
Right.
We want to make sure there's a network, there's a holistic ecosystem along with government services to prioritize the healthcare needs of women, especially the underprivileged, the disabled, refugees, and the ones who are going to find it difficult to get access.
And do you find that when you reach the ground level and you're going to these PPR flats and you're reaching them, is it hard to convince them to go to do these tests?
There's a lot of fear. There's a lot of fear. I think it's not just me. To be fair, there was a Sandakan member of parliament, Vivian.
Right.
There's a lot others, right, who came together. We started with supporting the ROSE program from PPM.
Right.
So women out there, if you haven't gone for your pap smear, please go for the human papillomavirus self-test kit, DNA test kit, with ROSE, and you'll get your results on the handphone. So what we did, first, the methodology. right?
Right.
Because pap smears, as a man, you must know.
Okay.
It is not popular.
All
Nobody
right.
likes it.
Okay.
Right? So you have to figure out mechanisms or tests that are friendly to women.
Okay.
So a self-test kit, which is far more comfortable,
Right.
developed by Malaysians themselves.
Oh.
Yes, it was
Okay.
developed by Malaysians in UM, and specifically for the ROSE program, right?
Okay.
It is not, of course, Yolanda would know more because she is the oncologist here. I am
Sure.
the engineer. But we can promote good ideas. But I think that's why when the first thing is to break the taboo.
Okay.
So when I was in Pematang Pau, we went to the market
Okay.
and we basically asked the husbands, not just the wives, has your wife gone for a pap smear examination?
Okay.
Why should we be embarrassed? Hey, it's
Yeah,
whether prostate cancer, whether cervical cancer, it's important for society to be, part of
Yes,
the solution,
yeah,
right?
sure.
And break the taboo. And I realized after the campaigning, we had managed to screen about 800 women
Okay.
in Pematang Pau during our 3 rounds or 4 rounds of program, and it brings results.
Okay.
Right? So it is about basically taking into account the social engagement factor.
All right.
Taking into account by listening to them.
Right.
Not speaking to them from I know everything.
Yes, yes.
But like a partner.
Right.
And then from there, taking into account their sensitivities, you will unearth results.
Okay. And so talking about some of these tests, what happens during this test and what happens after that with the test results?
Yes.
Yolanda?
So with the self-sampling for HPV,
Right.
for cervical screening, there are sort of 3 main organizations that are doing this now in Malaysia. So
Okay.
Ministry of
Alhamdulillah.
Health have their own program as well. LPPKN under the ministry as well. Women and Community Development also have a program.
All right.
And of course, we've got NGOs such as ROSE, which is
Right.
based at University Malaya,
Right.
also running this program. So it's
Right.
really encouraging to see since 2018 that the ecosystem for screening has really expanded.
Right.
And also, just want to mention Datuk Sri Wan Aziza, when she was Deputy Prime Minister back in
Right.
2018,
Yes.
she really did a wonderful job of advocating for the switch from pap smears using a speculum examination,
Right.
which many women find very uncomfortable, undignified, and they're afraid of.
Okay.
And also, it's less accurate. It's only 50% accurate.
Okay.
Switching to a self-test with
Right.
HPV DNA, so a do-it-yourself test kit.
Okay.
That women can actually do themselves.
Right.
So they can actually do it in the safety and comfort of their own home.
Right.
They can do it. We've basically done screening in mosques, in schools,
Okay.
throughout the community.
Right.
And this test is highly accurate.
Okay.
So it's got a more than 90%
Okay.
accuracy rate.
Right.
And also WHO has shown that in low resource settings, women only need to screen twice in their lifetime. So at 35 and 45
Okay.
in order to pick up the majority of cervical cancers.
Right.
And actually, this test is so much more user-friendly than a pap smear, where women
Okay.
have to screen usually about 15 times in their lifetime because they need to screen every 2 or 3 years.
Okay.
So we've seen that, Ministry of Health, Ministry of Women, Community and Family Development, and programs such as ROSE have done a huge advocacy drive or push to really get this taken up. But
Yeah.
what we now need to do is actually increase awareness about
Right.
this test. So that's why going out to the community, not waiting for women to come to the hospitals or the clinics, but actually
Yes.
taking the program to them in the community,
Right.
and also demystifying it. So not asking women to come for a cancer screening program because
Right.
nobody likes the word cancer.
Sure.
The big C.
Yeah, the big C, yeah.
So basically, what we try to do is we link up with community health champions. So these are women who are already leaders in their own right in the community.
Right.
And as Izzah was mentioning, we can work with groups such as AIM, Amanah Ikhtiar Malaysia,
Okay.
who've also done a fantastic job on women entrepreneurship. So
Right.
when the women come together for their leadership talks or their training for entrepreneurship, for economic empowerment,
Yeah.
we tag on the programs for health literacy at the same time.
I see.
And it's not just cervical screening, but also breast cancer screening, because obviously,
Sure.
breast cancer is another,
Number one.
It's number one killer, yeah.
Exactly.
Yeah.
And something which, again, women are very afraid to engage in terms of screening for mammograms, etc. So we have a program called Know Your Lemons,
Okay.
and this is where we basically use the lemon as an
Right.
example of a breast, and to basically link it to the 12 signs of breast cancer.
Okay.
So when I first started trying to talk to women in the community about breast cancer, you'd get stunned silence.
Sure.
And nobody wants to look at a picture of breast cancer. It's,
Yeah.
very
Okay.
frightening,
Very
very off-putting. But if you show them the picture of a lemon, and we actually bring lemons into our training as well.
Right.
And we usually start with an icebreaker where we basically play a game with lemons.
Okay.
And then you get the women laughing, you get them very relaxed, you
Yes.
get them, talking to each other. And this becomes a very easy and a very acceptable way to
Right.
talk about breast cancer to these women. So that's the program that we've basically been championing in the community through our Community Champion Network.
So I gotta ask you this, Izzah, because you've been in government and you're MP in the past, and is
Backbencher lah.
Sorry?
Backbencher.
Backbencher.
But it's true, yeah.
I mean, you're closer there than me, than Yolanda and me. Okay, so I gotta ask you this: is it fair to assume for people that this is the government's duty, they must do this without any help from anybody, or where do you think? Because I mean, you've already shown with this think tank, these organizations, this partnership, you're reaching people, because sometimes I think government is too big. They move like a fleet, and this needs to be targeted. This needs to move around. Needs to be able to pivot.
No, you're absolutely on point. I think first and foremost, we cannot forget the lessons of the pandemic.
Yes.
And during the pandemic, it was really the CSOs, the third sector, that held things together, that kind of ensured the last mile connectivity, delivery, assistance and aid, were given.
Right.
So for me, under even the Economy Madani, they mentioned the importance of CSOs. And I was really struck by so many of these efforts that actually teach us how things can be done far more innovatively. Right. And it's a good thing, because the government does not know everything. I think there's an important rule, right?
Yeah.
And of course, the two areas that the government must provide sufficiently for is education and healthcare. But then again, in the ecosystem, you have so many stakeholders, and you want more people to also understand and realize they are, fulfilling their potential, empowering them, empowering the women, even the CSOs. So there's many, many ways to do this. I think one of the ways that we were looking at when I was doing my research is matching grants, right? So the government understands sometimes you don't want to compete with the CSOs or the existing entities. You want to actually kind of leverage and complement each other. So the Ministry of Health, kudos to them, have just signed an MOU with the Rose NGO or Rose Foundation. And I think that's important, it's very healthy, because you want to make sure in this quest to eradicate cancer, for example, right? You kind of need everyone on board.
Right.
Now, on the other bit of making sure the ones that are in far-flung areas,
Yes.
it's going to be very challenging, because you don't necessarily have to have a hospital in situ.
Sure, right.
There's one being built in Lawas after many, many years.
Yes.
But for every hospital, you need to consider staffing.
Right.
It comes with such onerous costs, right? But then you want to make sure Malaysia spearheaded this and Thailand followed suit. What was it? It was making sure we had caregivers, health care caregivers at the forefront of society. When you give birth kat kampung, it will be the nurse from the nearby clinic, kerajaan, klinik kesihatan, that will come and check up on you, right? So you want to make sure that also receives sufficient support. Because at the end of the day, it is making sure that primary care is being addressed, one. And also number two, I think, which perhaps the government is looking at through the white paper and should be done far, far more effectively, is the investments, including by every sector, whether you have a company, you want to care for your workers and staffers, is preventive healthcare.
Absolutely.
I think that's the bit that we don't give enough sufficient focus on, right? I think we spend about only 8 to 12% annually. And frankly, you also have to realize, even HPV, it is in a way preventive, right? Can you say that, doctor?
So with the vaccination, yes.
Yes, with the
Okay.
vaccination.
Yes.
Yeah,
And
to have
Malaysia actually
vaccination.
does very well in terms of vaccination uptake.
Yeah.
So it's actually one of the leaders in the world before the COVID pandemic,
Right.
with the leaders in uptake of more than 90%
Okay.
amongst children of school age.
Right.
And obviously, unfortunately, during the pandemic, there was a bit of a lapse because
Sure.
of the lockdowns, etc.
Absolutely.
But the government is now focusing on catch-up vaccination.
Okay.
And also we have other CSOs such as the National Cancer Society of Malaysia and
yes.
CSM working together in partnership with the government to bring vaccination to those who might have been lost within the system. So
Okay.
some undocumented persons,
Right.
or young women who may not be within the
Right.
formal education system, etc.
Like I have to say, NCSM, National Cancer Society of Malaysia, I learned so much from them because
Right.
they helped me screen so many people in Lembah Pantai.
Okay.
And, so I did collaborative kind of framework in terms of joint programs, I mean, including the Rotary Club as well,
Sure, of
right?
course,
But the
yeah.
point is, these are part of the CSO landscape, aren't
Yes, they are,
right? Even
yeah.
Rose came up with an innovative program, and what's special is because everything's interconnected. You'd go for the self-test,
Okay.
right? And then in 2 weeks, you get the results in your handphones,
Okay.
as well as an alert to where is the nearest follow-up
Linkage to care.
Okay.
linkage to care.
Right.
Because you can't just test someone
Sure.
and they are positive. You can't just, and you're not telling them where to go.
Right.
So it has to be really intentional
Okay.
in terms of the things that you do. And, it is important for us to work together in this. So that's why for me, when I see Malaysia, I think what we want to reduce is the work in silo mentality.
Yes, I totally agree with that.
Yeah, because honestly, we're in this together. We
Yes.
can't assume there's okay, this is just the government way, right? There's no other way that matters. But actually, this is the private sector way
Yeah.
because we're all part of a collective whole.
Yeah.
So for me, that would probably be my reminder because in a way, I'm not entirely government, but I'm not entirely outside the government. And you're
Sure,
right.
yeah,
So we try our best to sometimes bring a message where when you have the best brains or the best ideas, the best innovative solutions from different quarters, but you are making it complementary so that you serve who?
Right.
Patients.
Absolutely.
You serve who? Students.
Yeah.
You serve who? The women who are in need.
Yes.
And the only challenge I face right now in this increasingly extreme kind of slant across politics around the world is the plight of refugees.
Yeah. Okay.
Undocumented migrants.
Right.
Because it's like we forgot the lessons of COVID.
Yes.
We knew that they were part of the solution.
Yes.
They had to be also vaccinated
Yeah.
to ensure that our lives are saved
Yeah.
or secured. But now sometimes that is a challenge in terms of advocacy, convincing people. So maybe you should lean on love thy neighbor or different types, right? Because I feel, it doesn't, you don't lose much.
Sure.
If you never lose when you are kind to others.
No, you're absolutely right. Because, I mean, if you look at the ecosystem of a country, whichever country it is, and when we're talking about Malaysia here, the chain is only as strong as its weakest link, which means it's the sick people, it's the vulnerable people, right? And if you don't take care of that, then everything starts to break down eventually. And, that's why I guess in some socialist countries like in Europe, they have a fantastic access system, they have all this screening that we don't do enough of.
They
here.
do have, but of course, tax per GDP is also higher.
yes,
so,
yeah.
or even the consumption tax introduction. So a lot of the policies, I think Malaysia, we have to also take stock
Yes.
where we are, what we need to do, and the fact that we have a heavily subsidized landscape as well.
Yes.
So for me, the point is just that we have to think about how to future-proof Malaysia.
Right.
And we're aging 15 years faster than we should.
Okay.
So there are many indicators
Yeah.
that kind of showcase, hey guys, it's important to be mindful
Yeah.
of how certain things, certain policies have to be tweaked and changed to meet the future needs of an older us.
Yes, we'll get to that older us before we get there. But you mentioned something just now about the people away from access to help. And I know Yolanda is very passionate about the work that she does in Sarawak, and this new hospital that's coming up in Lawas. Tell us a little bit about it and why it's absolutely necessary to be able to be a shining light on top of a hill for those people there.
Yeah. No, absolutely. So I think one of the stories that maybe is not so widely shared is that actually Izzah herself has really been an advocate for healthcare in rural settings for many, many years now. So for like over a decade, even when she was Member of Parliament, she was actually campaigning for better healthcare access in Sabah and Sarawak, and specifically to this hospital in Lawas. And I think what's quite interesting is that the Lawas hospital was actually approved back in 1996 budget, if I'm not mistaken. When PM was actually MOF minister for the first time. So it has taken 29 years to build a 76-bed hospital. So obviously there's quite a lot of systemic issues around that.
Yes.
But why it's so important is that Lawas itself is, at the junction between Sabah and Brunei. And so to basically get to another hospital in Miri, you have to go through multiple checkpoints. And then the checkpoint between Sabah and Sarawak closes at midnight. So there have been cases where women are trying to give birth who basically have encountered fetal distress, etc., couldn't get to hospital in time. And there have also been cases of maternal death. Most famously, it was the Kam Agong case. A number of years ago. And Kam Agong was a woman who basically unfortunately died as a result of a maternal complication. So we're very happy now that actually the hospital is finally going to be open this year, we're told.
This year?
So we believe it's going to be completed in June from our latest reports. But I think this also speaks to a wider systemic issue across Sabah and Sarawak, which is the need to really strengthen the healthcare system. The other thing that we're very glad about is that there has been commitment on both the federal and the state government side to build the Sarawak Cancer Centre. Because we do see patients really struggling to get adequate cancer care. And we have fantastic doctors and nurses that are working in the public sector. And right now, most of the patients for cancer care in Sarawak will be referred to Sarawak GH, Sarawak General Hospital. And the work that the doctors and nurses do there is just incredible. But obviously they need to have the tools in the toolkit to be able to deliver the highest standard of care. And despite all the challenges, Sarawak has really trained up an excellent group of doctors to also focus on research. So I don't know if you know, but Sarawak has the first in human phase 1 unit that was basically started many years ago, but it actually started to do clinical trials about 18 months ago. And this is exciting because it means that it actually increases access to clinical trials for patients in Sarawak and across Malaysia. And just coming back though to the whole screening program, the whole screening idea, I think Malaysia, it's an amazing ecosystem because there are so many CSOs, so many NGOs working in the voluntary space. And even during the pandemic, we saw how so many of these CSOs, NGOs were doing the food distribution, the food baskets, etc. But I think we really need to harmonize the work between government and the CSO sector, the private sector. And also there are many private sector players that can also give support to the CSO work through philanthropic giving, through corporate social responsibility giving. And I think that's something that, it would be really good to see that more joined up specifically on women's cancers. And just to give you an example, during the pandemic, I worked with a lot of community women that were doing food basket distributions. So at the time, we couldn't access women to do the screening programs for breast or cervical cancer. But what we did do is we put a Know Your Lemons leaflet in their local language, so localized to Malay, Chinese, Iban, into the food basket. So that women who received the food basket would then also receive this leaflet that they could read and they could also put onto the wall of their longhouse, for example. So as a way of increasing visibility, increasing understanding. So, and also we have a lot of retired nurses who are super passionate about wanting to serve their community. So again, in Sarawak, one of our methods for in doing screening and also increasing the health literacy for breast and cervical cancer is actually to enroll these retired matrons, retired nurses to work with us on the community outreach. Because if someone like myself goes in or another doctor and starts trying to speak to the community, even if we may try to speak in Bahasa and try to localize ourselves, there will still be some barriers, there will still be some walls for us to break down. But if you have a local nurse from the community who speaks the local language, the local dialect, immediately those barriers evaporate. And that trust, is built as well. Using retired nurses, community advocates, community champions is really important in the co-design and the co-development of these screening programs.
Yolanda just touched on something, a system where CSOs can work properly with government. Is there something that can be done to improve the current landscape for that, in your experience?
I think we need to understand that as is, the landscape for aid within or by government agencies and ministries is so fragmented. So there is that effort, right?
Yeah.
First and foremost, to ensure there's a proper integration, because it actually increased from the year 2019 to today. So
Yeah.
I think at the end of the day, we have to figure out how do we make sure that the targeted aid, right, is getting the outcomes or making the impact that we should. And eventually, there is a framework of mapping. You have to make sure that it's easy for the philanthropists or the companies to contribute, but they will not be able to do so if it's not organized.
Yes.
So I agree with you. Sometimes even apportioning assistance or aid, it also depends on how many CSOs and which CSOs are serving which community.
Right.
And the more they serve, then the more they should be supported.
Right.
So I believe they work to integrate the fragmented social aid
Right.
system is there. It's usually being held together by the MySPC, the Social Protection Unit, which
Okay.
resides under the Implementation Coordination Unit, ICU, the Prime Minister's department. But they are probably the ones that have the most institutional memory, because they've
Okay.
been there across many governments.
Right.
They are also able to identify and segmentize the three different support that's given by government: labor, what do you call it? Market interventions,
Right.
right? And then there's social insurance,
Right.
and there's cash transfers,
Right.
social aid. So basically, across the different different state governments,
Right.
they'll have different types of interventions and support. So if we don't, for example, legislate cash transfers, then
Sure.
it's not going to be included or measured by the International Labour Organization.
Okay.
So the way we do this properly
Right.
will also elevate our standing
Sure.
regionally
Right.
and, of course, globally. So for me, this is one of the key aspects. We cannot take it for granted,
Right.
because in order to plug in the different types of support, contohnya know your lemons.
Yeah.
At any given moment, the government, not just the state but federal, should also be aware of the existing programs.
Yes.
And then which can be scalable, which can be sort of and from there, you're able to manage more communities.
Okay.
But what's happening when it is not organized?
Yeah.
Then there's repeat. There's a lot of those who are left behind.
Right.
And usually one PPR or two, there's going to be 5 to 10 PPRs that are well known. You
Right,
have Rotary
yeah,
Club
exactly. Yes,
going.
yeah.
You have, all the institutions and foundations going because they're well known. So social capital also extends at the very level of even aid distribution.
Sure.
Right, so the more, I remember there was about last Ramadan, we decided to kind of find a very, an orphanage but based in Klang. I never
Right.
actually went there, but we realized they were never approached the whole, because they're really quite far out, right?
Okay,
So
right.
sometimes it depends as well. All these things matter.
Sure.
If you're in a landlocked area, so in comparison, if you're in the city. So one of the beautiful things about the city is vibrant,
Yes.
it's bustling, and it's connected.
Right.
So how do we make sure, and this has been shown through the research in why cities thrive more
Right.
than certain areas. So how do you make sure you bring that energy in the aid distribution? So government has to kind of go ahead and improve and formulate this kind of matrix. And this doesn't just extend to aid.
Okay.
But for me, something like the education, because even schools
Yeah, yeah.
across Malaysia, right? There's many CSR giveaway,
Sure.
and I would urge all the companies, let's not just focus on giving bags
Right.
for school kids. That's the easy bit.
Yes.
Maybe we kind of try to figure out how do we support CSR through meaningful contributions, right?
Okay.
Adopt a school.
Right.
Adopt programs.
Right.
Make sure you are spending your time even giving tuition, because time is money, right?
Yes.
Time is valuable.
Yes, yes.
And the fact that you're giving your time, Manvir, to share your insights, to promote knowledge, that matters far more not than just, a giveaway. So for me, perhaps slowly through awareness, and also in a way the government has to go a long way to do more to encourage the CSOs to be part of the solution, not competing with one another. So it is taking place
Right.
within the government first and foremost, but I think we just have to quicken the pace.
Okay.
Because time is not on our side.
Okay. Right. We're going to take a quick break. We'll come back with more right after this. Okay, we're back with more right here, Healthcare Simplified with Manvir. As always, do hit that subscribe button. And we're still talking to Nurul Izzah and Dr. Yolanda here. And I just want to talk about something it's close to me, and I know it's something that's close to you as well, with patients who are undergoing renal failure. Renal failure. Now, this disease, I had me 10 years. It took me 10 years to get a transplant. Far too long. Our neighbors down south, you can do it in a year. So it's disappointing in that sense, because we have the specialists here to do it. We have the infrastructure. We don't have enough of it. It's not invested in too much. But, the number of people, now, just to give you a number, 50,000 people are currently on dialysis in Malaysia. And that number is increasing by 10,000 a year. We're expecting by 2030, 100,000. So if you're talking about a broken system, it's not going to get better, right?
Yeah.
And I know you were just mentioning to me before we started about some of the issues that PPR flats, the people there, and women who've got kidney failure, and they're supposed to take care of the home, the family. It's tough. Maybe some of your personal stories that you've heard from there itself.
I remember I was visiting a dialysis center.
Yeah.
And some of them, the patients were speaking to me, and one of the guys were actually teary-eyed, and he was just saying, "For goodness sake, please just create this awareness, because don't wait until it's too late." And now I'm stuck doing dialysis, and of course there are also help and support in terms of providing care. They have provided logistics for people from the PPR to go for dialysis, but I think his point was preventive care, the preventive healthcare as well, like making sure that people understand the importance of, whether it's sugary intake, dietary requirements, nutrition. And I mean, again, I'm not an expert on renal care, but I just felt so affected.
Yeah.
Because and when I was in Lembah Pantai, it was one time I was visiting a patient, I think in one of the emergency units, and within 1 hour, I had 3 deaths, renal failure.
Yeah.
So it was just astounding. I never thought, it was so severe, but it is severe. And sometimes, the more things stay the same, the more we will suffer. So I know it's unpopular. I always go to, when I balik Pematang Pau, and I always tell them for Ramadan, please don't take the sugary drinks, please don't take the coloured drinks. And I think I'm the most unpopular it's a dinner. It's like, jagalah buah pinggang anda, right?
Yes.
So I just met the team yesterday, and one of the ladies, Kak Hajar, she's been in and out because she's got her kidneys are inflamed. Right? She's younger than me. In her late 30s, and I can't believe it. Like, astaghfirullah, something has to be done.
Yeah.
And I hope that we, of course, perhaps maybe have to start in schools.
Sure.
That means, healthcare and educational literacy, kind of healthcare literacy, it has to start from the school itself. We heard about the young boy, right, who suffocated from the candy, and apparently I was looking at it, funny, not funny, but it's quite shocking to know that there's also deaths associated by mochi in Japan.
Oh.
Yeah.
Okay. Right.
So again, the point is every society faces this. The issue is, how do we make sure our children know the importance of caring for their kidneys from the get-go, from 7 years old. Right? And how do we, because it's also about setting the mind, cultural norms, and what's available out there.
Yeah.
And you go out there, whether it's the Pasar Malams or whether, unpopular opinion, I know, but I felt that Pakcik, has spoke to me. It was like he's given me this reminder, you have to do this. And I'm so glad today we're here, Manvir. Thank you for inviting me. And I felt, I have to say this. So it really requires policy implementation and intervention,
Right.
which could be very unpopular, but also really making sure educationally we're able to change our children and their parents
Sure.
as to their habits, eating habits. And yes, the next bit, which I think we shouldn't ignore, is the fact that we have to make it easier. 15 years, you said.
Yes, 10 years. 10 years.
10
from now,
years,
yeah.
right? It's that's
It's
untenable.
demand.
Yeah.
It's extremely painful and
Yeah.
suffering, and I mean, you as a doctor, I'm quite sure you've seen that happen with a lot of patients. And we the preventative health aspect is the preventative done well enough in a lot of countries. In a lot of countries, we're trying to get there. We're all trying to move the needle. But for yourself as well, Dr. Yolanda, I mean, you see that the education. How do we get this to? I think now this is me again. I think that women in the home who know more mean a healthier family.
Yeah.
Am I wrong in that?
Yeah.
Am I wrong?
No, I mean, absolutely. So I think that's why we do have certain link-ups now with, for example, Think City, collaborating
okay.
together with Thrive Well on the first 1,000 days of life. So they're doing a pilot program in Bandar Tun Razak.
Right.
And they're working together with community women from the PPRs, the low-cost flats, to basically enroll women who have just given birth. In a program that basically educates them in terms of nutrition, in terms of how to care and how to basically the developmental milestones of children within the first 1,000 days of life. Because there's a lot of research now that shows that your future risk of developing cardiovascular disease, of metabolic syndrome, of even cancer can be linked back to the first 100 days of life in terms of nutrition, environmental exposures, etc. So I think we really need to go to the heart of educating our women. And when Izzah and myself first thought about, who we wanted to target or focus on in terms of our community outreach, we realized that women were very much at the heart of it. Because as you said, they are actually the glue that holds the families together. And if you educate the woman basically on all aspects of healthcare, but also on nutrition, on environmental health, etc., the chances of actually then having a positive impact on the children in that family is also much higher. And then also don't forget that women actually represent the majority of the informal unpaid caregiver sector in Malaysia as well. So they're taking care of elderly parents, in-laws, etc. So, and also in Malaysia now we do have Peka B40, which is a program that was introduced by the government back in 2018 to basically screen for non-communicable diseases. And they also have screening for cancer, including cervical cancer, breast cancer, etc. So, you've got to really look at the window of when you can target a woman to engage in screening. And when you have her there, why not, apart from doing breast and cervical screening, why not also screen for hypertension, high blood pressure, for high cholesterol, for diabetes, for hepatitis C, which can cause liver cancer. So you're bringing it all in one, and you're making it easy for that woman to engage in the 15 minutes or the 30 minutes that she has to actually do that. But by doing that, you can basically then cover her for the next 5 years. So, she then knows that she does not, she's not at risk of developing a significant healthcare issue within that period of time. So I think that's really important, making it accessible, making it friendly for the women to engage, and then really targeting, communities where women are coming together. So one of the things that Izzah and myself have done in Penang, for example, is that we've tried to also do talks with community women in the mosques. So when the women are coming together to basically do their Quranic studies or classes, those women, the ustazas, etc., that are basically leading them, can also include healthcare interventions in that kind of setting. So I think, it does come back to a whole of society approach, but really designing it so that women are front and center of this project. And then
just want to also add that for renal stage disease, I think Malaysia has one of the highest incidences, and there is also, I don't know if you're aware, maybe you can share a bit more, the Ministry of Health's kidney blueprint.
Okay.
Yeah.
Yeah. So I
National Action Plan for Healthy Kidneys.
Yeah,
Okay.
yeah. So again, I think it comes down to the fact that we need to engage in screening. We need to manage things like diabetes, hypertension, blood pressure. We also need to encourage people to not smoke. So smoking cessation is actually
We're so unpopular.
a huge.
We Assyrians are so unpopular.
Yeah, and then of course we've got sugar tax in terms of encouraging people to go for air kosong rather than the sugary, colorful drinks, etc. But also understanding the nutritional intake of food, because I think that's something that's very poorly understood.
Sure.
And obviously Malaysians, we do have great food culture. We love our food, but then I think
We're the most obese in the region.
Yes, exactly. We're number one.
Yeah. So I think having a balanced diet, and again, who's preparing the meals? It's
Yes,
the women
the
at
women,
home, right?
yes.
And also in the stalls, the vendors, in the pasar malams, etc. If we can incentivize them to basically
Yeah,
offer a healthier option,
Yeah.
and if people are also moving more, we do not walk enough in Malaysia.
Right.
Whereas
Sedentary
getting in our
lifestyle.
10,000 steps a
Yes,
day could make a huge difference, and that's where things like wearables, etc., could also help.
So I'm going to ask you, because we're talking about this, right? And we're talking about it from a woman's point of view, right? Woman's point of view. Now, what can the man do to help facilitate this? Because I know that very wrongly sometimes men are the head of the household. Therefore, if the man allows the woman to go for a test, allows all these things to happen. So, I know that men watch this program as well. And we've got two Asuntarians here. But the Paulian is going to come out and say
Saint Paul,
something.
yeah.
Saint Paul's come out and say something. What do men do when they watch the show? I mean, what's your words to them?
I mean, I would say thank you for listening. You're part of the collective solution. We're happy that if you can empathize and can be part of this campaign, it's all the more important. Like most of the campaigns that have been successful because men were part of them, right? They ensured that they were counted in, and they provided through the Think City programs. They're part of the volunteer grouping. So for me, I always want to make sure that we feel that we have agency.
Okay.
That no matter what happens, no matter your social or your economic background, you have agency. You can do your bit.
Right.
You have that space of control, and that's why we have to make sure it is inclusive. This call, this campaign. Right. And I think one of the things that Yolanda mentioned earlier was the fact that even for women, right? I think sometimes it's hard to speak up. You feel that you're not important enough. There are other things that are more pressing. But even for policy making or raising these issues, it's always going to be politicized or racialized.
Right.
And it doesn't really matter at the end of the day. During COVID, we don't really care about the color of our skin, right?
Yeah.
So similarly, right now, we really have to think about how Malaysia and Malaysians are going to be far more comfortable living a better quality of life 20, 30 years down the road. And I think it begins by basically acknowledging that we have a huge and mammoth problem before us. So I try my best, and I think what's important is to scale up the good and successful pilots.
Okay.
And sometimes you have to just address certain things. If there's escalating prices, etc., let's discuss this in a very, even, in a rational manner, which is difficult. I know. But the point is, I think everyone should band together for education and healthcare, from St. Paul, from Asunta, to you.
Yes.
So I think it can be done, and it's just that we also need to ensure that with all these plans, whether it's kidneys, whether it's HPV, whether it's the white paper, it's about its implementation time.
Yeah.
And I think the ministry has addressed the issue of DRGs, of the fact that they have certain programs, but we need to make sure it's seen within part of a bigger picture, and it involves the stakeholders, i.e. the doctors, because we talk about this, but services are still going to be affected by maldistribution, by the fact that doctors feel overburdened, right? So a lot of empathy for men, women, doctors, patients goes a long way.
Yeah. Any final words, Dr. Yolanda?
Well, I
Yeah.
think St. Paul's is in Seremban, you
Yes,
said, right?
yes,
And
yes.
basically, men are the head of the household, but not in Negeri Sembilan.
Oh, yes,
so I
yes,
think
yes.
you've
Macam
forgotten your...
society.
But actually, so I think jokes aside, men basically have to really be encouraged from a young age, educated to respect women.
Yes.
So this is also about gender empowerment, gender equality. Every man has a mother. He may have sisters,
Yes.
and he may also have a wife. So treating women with that degree of respect, understanding that if a woman basically needs to undergo screening or treatment for breast or cervical cancer or another medical condition, there really should be no barriers and impediment. And we really want to see more men coming forward to support their wives, to be healthy, to get well, and so that they can continue to live a good life with their families, for example. So I think that's really important. And just to finish off, I think in terms of the heart of policy making, for too long we have actually seen too many parliamentarians ignore the issue and the plight of women representation, but also policies that are focused on women, that are developed by women for women. So we really need to push into the heart of that. We need to see women being prioritized more in our healthcare budgets, in our general budgets in general. And it's going to basically be for the peace, stability, and the good of not just Malaysia, but the region. So
I just want to add one clear present danger. The fact that there is this growing gender-based polarization that's taking place where some men, younger men, feel displaced from this advent of empowerment of women, right? Where women are taking up far more roles in public life, in civil service. And you see this in the US, South Korea, Europe. So for Malaysia, I think it's important to always dignify everyone. We need everyone to be part of this nation building exercise. So whether it's men who might not be academically oriented, but if they get meaningful jobs with mobility. So through TVET, there is that focus by the government, but the point is within society as well, we put so much importance on social status, right? But then we really need to figure it out, because for every role that you give to a woman, you just have to make sure that men also understand it helps you, it elevates you, it elevates society. And I think we be best to be aware and manage this, then we can inshallah avoid the pitfalls that come from any introduced plans.
Well, thank you so much for your time and your experience, your sharing and telling us what is happening on the ground here in Malaysia itself. Thank you so much, Dr. Yolanda. Thank you so much, Izzah, for being
Manvir.
here and coming out and talking to us about the real issues that are facing the real people. Well, thank you very much for being a part of this Healthcare Simplified with Manvir Victor. Be back with more soon. We'll see you. Bye.